During the COVID-19 pandemic, many people have had fears of contracting COVID and may have skipped cancer screening tests. There are a few screening tests that can help early detection of cancers, such as breast cancer, cervical cancer, colorectal cancer, and lung cancer. These screening tests are essential to early diagnosis and treatment. I'd like to briefly discuss the available cancer screening tests and who should get tested. First, breast cancer screening. Breast cancer is the most common cancer among women in the United States. Out of 8 women will develop breast cancer in her lifetime, and it is estimated that over 43,000 women will die from breast cancer in 2021. Medical societies have different opinions on when women should start and discontinue screening mammography. In general, women ages 40 to 44 should consider getting yearly mammograms. Starting at the age of 45, women should get mammograms every year until the age of 54. For women 55 and older, mammograms should be done every 1 to 2 years. The mammograms should be done continuously as long as you are in good health and are expected to live 10 more years. Second, colorectal cancer screening. Colorectal cancer is the third most common cancer in both men and women in the United States. 1 in 23 men and 1 in 25 women will develop colorectal cancer in their lifetime, and it is estimated to cause about 53,000 deaths in 2021. In general, people should start colorectal cancer screening at the age of 45 and should continue the screening through the age of 75. If you are between 75 and 86 years old, you should discuss with your physician whether you still need colorectal cancer screening. People age 86 and older do not need to have colorectal cancer screening. Several tests are available for the screening. Stool tests such as the fecal immunochemical test, also known as FIT, detects hidden blood in a stool sample. It is non-invasive, convenient, and can be done at home and should be repeated every year. Stool DNA test is another type of stool test. It is available as Cologuard in the United States. This test detects mutated DNA in the tumor and hidden blood in the stool sample. It should be done every 3 years. If either stool test is positive, a colonoscopy should be done to find out the cause for the positive test. Colonoscopy is another commonly used screening method. During colonoscopy, your doctor inserts a thin flexible tube which has a camera and light at the front end. The rectum and the entire colon can be visualized, and biopsy or removal of suspicious lesions can be performed during the colonoscopy. If the colonoscopy is normal, it should be repeated every 10 years. Other methods of screening, such as flexible sigmoidoscopy, CT colonoscopy, also known as virtual colonoscopy, if chosen, should be done every 5 years. Third, cervical cancer screening. The pap smear test has drastically decreased women's deaths from cervical cancer in the United States. However, there still will be about 15,000 new cases of invasive cervical cancer a year. It will cause about 4,300 deaths in 2021. Cervical cancer screening should start at the age of 25 and should be done routinely until the age of 65. The recommended screening test is primary HPV test, which detects the DNA of high-risk HPV or human papillomavirus inside cervical cells. The co-test, which combines the pap smear and HPV test, can detect both HPV DNA and cervical cancer or precancer cells. The primary HPV test and the co-test should be done every 5 years. Women who are over 65 and who had a normal pap smear in the past 10 years should discontinue cervical cancer screening. Women who have a total hysterectomy due to non-cancer reason should also discontinue the screening test. Lastly, lung cancer screening. Lung cancer is the second most common cancer in both men and women in the United States. 1 out of 15 men will develop lung cancer in his lifetime. For women, the risk is 1 in 17. Cigarette smokers have a much higher risk of developing lung cancer. It is estimated that about 130,000 people will die from lung cancer in 2021. Low-dose lung CT scan is the recommended screening test for people at high risk. Everyone who meets all of the following criteria belongs to the high-risk group and should have the low-dose lung CT scan every year. Criteria number 1. People who are currently smoking or who have quit smoking within the past 15 years. Criteria number 2. People of the age of 55 to 80. Criteria number 3. People with at least 30 pack years of cigarette smoking history. The number of pack years of smoking is calculated as the number of packs of cigarettes smoked daily times the number of years of smoking. For example, if you smoke 1 pack of cigarettes a day for 30 years, the pack years is calculated as 1 times 30, which equals 30, meaning you have 30 pack years of smoking history and you are recommended and eligible for a low-dose lung CT scan. In summary, several cancer screening tests are recommended depending on one's age, gender, and smoking status. Please contact your physicians to see if you should have any of the tests done this year. Finally, please be kind to send this video to your relatives and friends to remind them of these life-saving tests. You may save someone's life. Thank you.